when Black, Latino, and Native American patients have access to Black, Latino, and Native American doctors, their health outcomes substantially improve. They are more likely to receive preventative services, they are more satisfied with their care, and they are more likely to live longer and happier lives.
That was Senator Bernie Sanders of Vermont saying that non-white doctors are better for non-white people than white doctors. And because the federal government does nothing but waste taxpayer dollars, these comments came during a hearing where there were two topics covered. The first one was how to get more non-white people to become doctors so that they can treat other non-white people, because as you heard before, Bernie Sanders is claiming that means they get better medical care based on race. With the second topic of the hearing being, and I'm not kidding, infant mortality rates, which is pretty ironic coming from politicians who support abortion. Here's the senator claiming to be worried about infant mortality rates, talking about abortion.
Today, the Supreme Court is hearing a case which could decide the future of Roe v. Wade. To me, this is not a complicated issue. It is a woman who has the right to control her own body, not the government. And I kind of think that if it was men who were giving birth, this issue would not be much in question. Thanks.
So back to the non-white doctor comments by Sanders. A lot of times when comments like these go viral on Twitter, X, YouTube, whatever, it will only be a 15, 20, 30-second clip that gets passed around. So I want to play Bernie Sanders' full opening statement in this hearing to give you an idea exactly what he was talking about, and I don't really think it changes much.
Today, our committee is going to focus on two extremely important healthcare issues that must be addressed. First, the major need for more Black, Latino, and Native American doctors and medical professionals. Secondly, the alarming rate of maternal deaths in America that is disproportionately impacting Black, Latino, and Native American women. In the midst of a healthcare system that, in my view, is largely broken and dysfunctional, where we spend almost twice as much per capita on healthcare as the people of any other country, where 85 million Americans today are uninsured or underinsured, and where we don't have enough doctors, nurses, dentists, mental health specialists, or pharmacists, we have another crisis on top of all of that, and that is that problem of lack of medical personnel is especially acute in Black, Latino, and Native American communities, which is the subject of our hearing today. Despite making up almost 14% of our population, just 5% of all doctors in our country are Black, less than 4% of all dentists, and just 6% of all nurses in America are African American. Further, despite making up over 19% of our population, just 6% of doctors and dentists and just 7% of nurses in America are Latino. And we cannot forget the Native American community, which makes up 1.3% of our population, but just 0.3% of all doctors in our country are Native American. So why is this an important issue that we have got to address? Well, the answer is that study after study has shown that when Black, Latino, and Native American patients have access to Black, Latino, and Native American doctors, their health outcomes substantially improve. They are more likely to receive preventative services, they are more satisfied with their care, and they are more likely to live longer and happier lives. In my view, it is unacceptable that life expectancy on average, which is low in America in general, is about 5 years lower for Black Americans and 11 years lower for Native Americans than it is for white Americans. It is unacceptable that Black Americans are more likely to die of heart disease and have the highest rates of cancer of any other group in America. It is not acceptable that Black Americans are more than twice as likely to have diabetes, an issue that we are dealing with right now. Major epidemic in America, twice as high in the Black community than the white community. And one of the most alarming and troubling health disparities in America is the maternal mortality rate, which is the other major focus that we'll be talking about today. In America today, we have the highest maternal mortality rate and the highest infant mortality rate of any other wealthy country on earth. In fact, the maternal mortality rate in America is 19 times higher than Norway, 4 times higher than France. Incredibly, according to the CDC, women in America today are twice as likely to die from childbirth than their mothers. And as bad as this crisis is overall, it is much, much worse for black women and infants. In America today, black women are nearly 3 times more likely to die from pregnancy-related complications than their white counterparts. The crisis is also getting significantly worse for Latino women. Between 2019 and 2020, the Latino maternal mortality rate skyrocketed by 44% in just 1 year. Meanwhile, black infants in America are almost 4 times more likely to die from complications due to lower birth weight than white infants. So the question then becomes, given that reality, what are we going to do about it? How are we going to address what is obviously a major healthcare crisis in America? And that is what we'll be discussing this morning. Just a few things that I think we've got to do. We need to substantially increase the class sizes of historically black colleges and universities, and we'll be hearing from representatives on one of them today. We need to pass the Black Maternal Health Omnibus Act introduced by Senator Booker and Senator Butler. Senator Butler will be talking about that today. We need to substantially increase funding for the Women's, Infant, and Children's Program. We need to substantially increase funding for the National Health Service Corps. And in my view, we need to cancel student debt and make all public colleges and universities tuition-free so that all people, regardless of background and income, will be able to get the education they need, including going to medical school. And in fact, the good news is that making medical school tuition-free is a growing idea. In fact, 4 medical schools in America, including the New York University School of Medicine, are currently tuition-free, while 5 others have made tuition temporarily free or are offering free tuition to working-class students. So we've got a lot to talk about today, and I look forward to a serious discussion about a serious issue, and I thank our panelists who are here with us.
So there you have it from Bernie Sanders. Non-white doctors are better than white doctors. The mortality of a child only matters once it's out of the womb.
As I think it was President Reagan said, we're from the government. We're here to help.